cannot believe it has been a year. March the 6th was the beginning of what we thought was going to be a short experience with COVID-19. But quickly we realized there was nothing fast about COVID other than the spread. March the 6th, I sent a memo out. March the 12th, we closed our doors. March the 13th was the state's national emergency declaration. So things moved very quickly. So we all learned how to take advantage of the time in the day and the time in the evening to regroup, reorganize, and get ready for the next day, because we knew it would be challenging and we knew we were up for it. But we had to keep our staff educated, motivated, and safe. In the beginning of the pandemic, we had noticed and had seen in other states that the supply chain was getting a little fractured. So we have a training center in Fort Worth that we were able to quickly convert that square footage into a PPE storage facility. So then we started outsourcing for additional PPE gowns, additional gloves, shoe bonnets, hair bonnets. As we got our arms around the situation, and I saw leadership really rise at all levels of the company, in our facilities, in our department heads, in individual staff members. We didn't have to look far to see the heroes that were right in front of us. I've never been more proud of our communications department here at Creative Solutions, as well as our IT department, because we had to increase all of our capabilities: Facebook, emails, cell phones, visitation through windows with speakerphones, plexiglass, all of those things, even basic how you get a patient to and from dialysis, all of that changed. How you have a care plan with families, how doctors made rounds changed. And I will tell you, it changed really for the better in many areas. We also hired at that time an infection control specialist, and she had hospital experience. And as we were interpreting new and increasing guidelines and memos from the CDC and CMS, we needed someone to help us interpret what they were trying to convey to healthcare as a whole, because long-term care is a small section, but a very important part of healthcare. We could not have asked for better community partners. And I mean everything from the Boy Scouts and the Girl Scouts wanting to do anything they could do to help, to our community governments, our county governments, and certainly just local citizens. As far as our families, they've always been our greatest supporters. They understand that we are delivering a service to them, and we are providing life-sustaining care for their loved ones. So they were eager for information, so we made sure that we pushed out information as fast as we could. We are caregivers to people. We are not caregivers to numbers. We can't allow ourselves as caregivers to marginalize lives by a tally, by referring to them, our residents, as a diagnosis. It was an adoption of ours really from day one. We called the residents by their name. And it kept us grounded. It kept us working as a team to save lives. We heard every name in our company on our conference calls at 10 o'clock in the morning. We knew the residents that were newly acquired with COVID because we heard their names, and we knew the residents that did not survive COVID because we also heard their names. And it is meaningful and it is impactful, and it drives us as a company, and it should drive our industry and has driven our industry to do the right thing. And that's to take care of our elderly, the greatest generation. It was a pretty remarkable moment. I remember I got a call from our Senior Vice President of Clinical Services, and he identified the facility within our company that would be getting the first vaccines. We needed to make sure that we did it perfectly so we could replicate it and keep it efficient and change as many lives with that miracle vaccine that we could. I truly believe that education is what changes generations and changes the way you do business. So I had a responsibility to make sure that as many of our team members and associates across the state saw me get the vaccine, because it didn't hurt and it was a simple injection. As thousands of our employees and residents have figured out, it is life-saving. It gives me hope that we will do better in the future, because unfortunately, our opportunity for these mass exposures are going to happen again. And how we manage them is really how we're going to come out on the other end of it. If I were admitting a resident to a nursing facility, I would ask to know what their COVID-19 policies and procedures are and how it affects the operation of the facility. The right questions would be, what does your COVID-19 plan look like? How is your staff trained today to respond if it were to be in your facility? And how do you ensure me that you are being transparent with the way you communicate to your staff and to me, a future family member? That is important, and facilities across the state and across the country certainly want to do that. We all just have different ways of doing it. We're able to provide testing for colds and flu and now COVID-19. We can prepare and store nutritious meals, change their pharmacy, medications. All of that is delivered under one roof without the patient ever having to leave. There is no substitution for a soft touch, an encouraging smile, and a nutritious meal that many lack at home. So there's great benefit in skilled nursing and the value that we bring to senior adults when they can't care for themselves, or the family is distant, or the family may not be well or have the skill set to do it. We feel the need of a very needed part in healthcare, and I think it'll continue to grow. I have a lot of confidence in our space in the industry. There is no substitution for skilled nursing care.